Hello viewers, welcome back to my channel. Good morning, good afternoon, good evening, depending on where you are watching from. As I said earlier, today I want to talk about a mother who has had a baby, but her baby is HIV positive. Yeah, there are some situations where we get mothers with babies who are HIV positive, though not very common these days, but we still have them. This happens mostly when a mother conceives without knowing, especially when she is viremic, or maybe a mother gets to know her HIV status when she is just about to deliver. So normally we have uh, almost nothing that we can do to help the situation. Now this mother has a positive baby. What do we do? How do we take care of this baby? So I want to give an advice on how to take care of this baby until the age of 12. That is still a child. So this baby, survival of a baby who is HIV positive depends on proper nutrition. This baby is supposed to be well fed. This baby is not supposed to lose weight. For a baby not to lose weight, this baby is supposed to be taken care of properly so that infections are prevented. Prevention is better than cure, and this is the time when we really need preventive measures. So the role of healthcare workers, we have a lot to do. We are supposed to immunize this baby. We are supposed to screen this baby for opportunistic infections. And if we find any, we treat. We are supposed to advise this mother on nutritional measures. We are supposed to be checking this baby every month. We are supposed to initiate this baby on treatment and advise the mother or the caregiver. Remember, there are some infants who are being taken care of by persons who are not their mothers. Maybe the mother died or the mother is mentally challenged. So we are supposed to teach them how to take care of this baby. Okay, so remember, this baby is supposed to be given vitamin A supplements. That is our role now, but it's just good for you to know. Children who have good weight and are given supplements during their clinical dates, and these are supplements that are given by us. Don't walk into a pharmacy and buy vitamin A and start giving your baby. That's our role, because they're supposed to be given at intervals. This baby will always survive. So just like any other person who is HIV positive, this baby needs a balanced diet. So there are some mothers who like giving babies food that is not balanced. You can find a mother giving baby rice during weaning, rice, sweet potatoes or Irish potatoes and pumpkins. If you give your baby this food, maybe every day, remember that you are not giving your baby proteins, you are not giving your baby vitamins. So we'll always teach you on how to give your baby a balanced diet. Any baby below 6 months is supposed to be breastfed exclusively. Why? Because breast milk has every nutrient that is necessary for the baby, for your baby, 100%. Not even water. Breast milk has enough water for your baby. So some mothers ask, nurse, can I give my baby water? No, your baby doesn't need water. Your breast milk has everything. Just breastfeed your baby properly. And for mothers who have to go back to work, you can express your breast milk, keep it, and your helper who is taking care of your baby can just be warming that milk and giving it to your baby. Ask your healthcare provider on how to manage breast milk. You cannot put breast milk in a sufuria and boil it. You put it in a tin and put it in warm water and it gets to the right heat and you give it to the baby. You don't heat it directly. These are informations that we give to mother when they come to us. Okay, breast milk is also very important to your baby because it has antibodies that is necessary to help in fighting infections. Okay, people who are HIV positive really need a lot of energy giving food because they normally don't have enough strength. That is a lot of biology that I can take a long time to explain. You need energy-giving food in order to have enough energy to help you do your daily activities, and so does the baby. Once you start weaning, make sure that all types of food are given to your baby. Your baby will grow. This is a baby who will be taking his or her drugs every day, every single day. Sometimes your baby will refuse. Sometimes they will ask you why. Maybe you have one baby who is HIV positive, is taking drugs while his or her siblings are not taking drugs. They will ask you questions. So, how do we go about this? This is what we do. For crying out loud, mothers, it is just the best thing that you can do for your baby is to plan to tell them why they're taking drugs. I've had young teenagers in support group complain that their parents refuse to tell them their HIV status, and curiosity got them to walk into a visiting center, get tested, and that is when they got to know why they are taking their drugs every day. And such kids become very bitter and rebellious. They are not easy to deal with. If you really love your child, the best thing that you can do is to tell them their HIV status. As a healthcare worker, we are always willing to help you disclose. But most of parents will say that, no, I am not ready for the kind of reaction I'll get from my baby. I am not telling them their HIV status. We respect that. As we can only give you advice, but decision is yours to make. So how do we go about disclosure? A baby who is below the age of 4, so 0 to 4 years, you just give them their drugs properly. Just make sure they are immunized. Make sure you bring them to clinic. Make sure they go to school. You don't have to tell them anything about their status. They are too young to understand. They can even disclose when they are playing. Okay, now our baby is between the age of 5 years to 8 years. This is a baby who is now interacting with their friends. They are telling stories. They are forming groups. They are becoming curious. Remember, they are also watching TV. Sometimes we talk about these things on television, and they can be taught by their peers. So if you don't give them information, they will find it somewhere. So the worst thing that can happen to your baby is to let them get some information from a wrong source. At this time, between the age of 5 to 8 years, or maybe to 9, we can help you disclose. At this time, you're supposed to tell your baby something little about HIV, why they are taking their drugs. You can tell them something like they have a certain germ in their system that requires them to take their drugs every day. They are born differently from their sibling. That's why their siblings are not taking the drug every day. That is why sometimes they become sick. And if they don't want to become sick, if they want to remain healthy, they have to take their drugs so that soldiers in their system can help them fight that germ. The soldiers have a name, and that name is CD4. Trust me, these children will take their drugs every day. And they'll remind you that, Mom, I've not taken my drug. I need to take my drug so that my soldiers can be strong. When these children reach between the age of 9 and 12, we are supposed to do full disclosure. Because if you don't, remember the curriculum teaches them about antiretrovirals. They can read the internet. They can Google. They can Google these things. And now imagine your child getting to know that they are HIV positive from another source, and maybe they've asked you and you're trying to be evasive. It's not fair. With the help of your healthcare provider, this child is supposed to know their HIV status and will help you with full disclosure. There are 4 steps that we take to make sure that your child gets to know their HIV status so that they can adhere properly, and we put them to a support group and we link them to their peers who have been disclosed to so that they can learn more. Now, sometimes we have a concern when mothers want to take their children who are on ARVs to a boarding school. And sometimes when they come back to us from boarding schools, they tell us that at one day they couldn't adhere properly because at the gate when they are going to school, security officers ransack their bags and ask them why they have those drugs. So sometimes they have to maybe hide them or throw them away. So I don't know, but this is just from my own view. I'm not talking on behalf of other healthcare workers. It's just a concern to me. Please take your child to a boarding school after they've been done for a full disclosure. And when you take them to a boarding school, link them to a matron. Let the matron know their HIV status. Let the matron know how they are given those drugs, and let the matron know that their status is not supposed to disclose, because their peers, their friends can stigmatize them. So children who know their HIV status and why they are taking ARVs are children who are good to go, and in most cases they do not spread the infection because we put them to support groups where they are taken care of. So taking care of a baby who is HIV positive is not hard. And then now remember that children like playing. Sometimes risky games. Just keep sharp objects away, because you don't want the positive child to use a sharp object, maybe cut himself or herself, and then the sibling uses. Do not segregate their equipments from others. Let them sleep together. They can use the same utensil. They can play together. Yeah, some people who are taking care of children who are HIV positive, like giving them their own cups, their own bedding, their own everything. That is stigmatization. That is so unnecessary. You cannot pass HIV infection by sharing, unless you are sharing a sharp object which you cut yourself with and the other person uses, and there is transmission. I hope you understand what I'm talking about. Yes, so remember, nutrition is important. Giving this child hard drugs, very important. Bring the child to the clinic every month. That's the reason why I don't want these children to go to school, to boarding school, and until they are able to adhere and they know their HIV status. Thank you for viewing. In my next channel, I am going to tackle one of the questions that was asked by a viewer. Thanks for watching. Subscribe, like, share, so that when I post the next video, you'll be notified. Bye for now.